Alrighty team, welcome back to Massage Therapy. I am Moy. Today, we're diving into one of the most common problems that you'll see in your practice, median nerve and hand pain. Now, the tricky part is that it doesn't always come from the wrist. Sometimes it's the wrist, sometimes it's the forearms, and other times it's even the neck or chest. So, in this video, we're going to break down 4 main culprits. First, carpal tunnel syndrome, pronator teres syndrome, thoracic outlet syndrome, and lastly, a bulging cervical disc. We'll talk about how to tell them apart, what signs to look for, and which muscles to treat, and what to avoid. Let's start with the one everyone knows, carpal tunnel syndrome. This is a compression of the median nerve as it passes under the transverse carpal ligament in the wrist. Patients will usually complain about numbness, tingling, or burning in the thumb, index, and middle finger, sometimes radiating upward towards the forearms, maybe about a quarter of the way up. The pain often gets worse at night or when they flex their wrist for long periods, like typing or hanging out on the phone. Now, here's the key. The palm stays unaffected. You typically don't see pain here because the palmar branch of the median nerve does not pass through the tunnel. That's one way to distinguish it from the others. As massage therapists, our main focus is not to press directly in the carpal tunnel. That's a big don't. Instead, work on the forearm flexors, especially the flexor digitorum superficialis, the flexor carpi radialis, and the pronator teres. Gentle stripping, fascial spreading, and a pin and stretch can always ease tension off the carpal tunnel itself. Finish by working the palmar fascia and encouraging gentle wrist mobility. Now, sometimes patients come in with the same kind of tingling and numbness, but the wrist tests negative. In that case, you might be dealing with pronator teres syndrome. Here, the median nerve is compressed higher up as it passes between the two heads of the pronator teres in the forearm. Now, what's the dead giveaway? Unlike carpal tunnel, this one often causes pain with resisted pronation and tenderness near the median elbow. The symptoms can look almost identical in the hand, but there's forearm pain that carpal tunnel does not have. When treating, focus on releasing pronator teres, the brachioradialis, and wrist flexors. Use pin and stretch techniques through pronator teres while the patient supinates the forearm. Avoid deep compression directly over the nerve path. It's just sensitive. Instead, your goal is to soften the fascial tension around the pronator and create space for that nerve to just glide freely down the arm. Okay, let's move on upstream to the neck. If you're seeing hand tingling that does not follow a clear local compression pattern, always check the cervical spine. A bulging disc, especially at C5 through C7, can press on the nerve roots that eventually become the median nerve. Here's how you can spot it. Symptoms often include neck stiffness or pain that radiates down the arm. The patient might feel tingling not just in the hand, but the entire arm and shoulder. Next, using the Sperling's test, neck extension plus neck bending plus head compression may reproduce their pain. Massage-wise, this is a lightly treated area. Do not try to fix the disc itself. It's super dangerous. Instead, focus on the muscle decompression. The primary muscles you should be focusing on are the scalenes, the upper traps, the levator scapula and suboccipitals are your primary targets. Gentle traction, positional release, and trigger point work can help reduce nerve irritation. Avoid deep cervical compression or aggressive neck rotations. Those are definite don'ts. Our role is to help restore mobility and blood flow, not to adjust or correct the spine. And finally, let's talk about the thoracic outlet syndrome, TOS, a sneaky one that can mimic all of the above. This occurs when the brachial plexus or subclavian vessels are compressed between the structures of the anterior middle scalenes, first rib, or under the pectoralis major. Here are the signs: tingling or numbness down the arm into the hand, often worse when the arms are raised or overhead. A heavy, weak feeling in the arms after holding postures for too long. Sometimes even coldness or color changes in the fingers. That's a vascular sign. The big giveaway compared to carpal tunnel, symptoms all go down the arm rather than staying in the hand. As a massage therapist, your focus should be on creating space, releasing the scalings, the pectoralis minor, subclavarius, and upper traps are your primary muscle groups to be focusing on when you suspect there may be thoracic outlet. Gentle first rib mobilization techniques, if trained, and breathing work can help open that space. Avoid pressing directly on the neurovascular bundle. Stay on the soft tissue. Encourage posture correction and awareness. Rounded shoulders or tight pecs often worsen TOS. Now, bringing it all together, quick recap. Carpal tunnel, wrist level, pain in the thumb, index and middle finger, and worsens at night. Pronator syndrome, forearm level, pain with pronation, with pain in the medial portion of the elbow. Bulging disc, neck level. Radiating symptoms may be weakness in the entire arm. Lastly, thoracic outlet, shoulder, chest pain level. Symptoms worsen with elevation or arms overhead. As massage therapists, our role isn't to diagnose, but to understand the pattern, respect the nerve path, and release the muscles contributing to compression. The better we understand where the problem starts, the more effective and safer our treatments can become. So next time you see pain or numbness, don't just treat the wrist, trace the entire nerve pathway. And always remember, less digging, more listening. The body will show you where to work. Cool beans? Peace out, and keep those hands smart and not just strong. Give that like button loads of popping for me. Adios.